Hello again, everybody. I said I was going to go live. If the signal goes off, which it might do, I'll have to just go downstairs. We've got some really bad weather. It's raining quite heavily. So I apologise if we go off and if the signal's bad. I hope everybody's keeping well. It's Sunday. Everybody looking forward to going back to work or starting a new week. Kids go back. Yay, for those who have been pulling their hair out this summer. So the kids go back. So no, that's good. That's really good. I wanted to talk a little bit about, I had a pre-op this week. So before you have an operation, I don't know what it's like in other countries, but in the UK we have a pre-op. So usually a couple of weeks before you go into the hospital just for like an appointment. You get weighed. I'm still fat. Certainly heavier than I've ever been. My face doesn't compare down below. See, still a little bit on the chunky monkey side. But they never say anything about my weight. I was worried that maybe they'd think I was a little bit not the right BMI, but I've got away with it. I'm still the same height as I've ever been. I'm 5'3.5", 160 something centimetres high. Probably got a BMI of about 30, so woohoo! Statistics. That's all we ever are. I had the pre-op, and what they check for is just standard questions. Have you got any previous history of problems with anaesthetic? Nope, apart from I don't come round quickly. I get very cold and I get very sleepy. Hi, Diana. Whereabouts are you listening from? I get very sleepy, very tired, but no problems with my breathing, no heart problems. They ask loads of questions. Yes, no. What medication do you take? I was advised not to take my medication to hospital because they'll take it off me, especially the tramadol. I won't be allowed tramadol in hospital because it's a restricted drug. So I was advised to not bring it in. What do? I can't stop taking it, so I'm going to have to hide tramadol. So I'm going to have to Pennsylvania. Ooh, many miles away over in the US. Pennsylvania. So I'm going to have to smuggle tramadol into the hospital. Oh, that'll be fun. I shall hide it somewhere. I'm advised not to take anything valuable, that kind of thing, advice. But I was also had my blood pressure taken, and I've got high blood pressure, and they took it twice, and it was high. Ready for my 8th. And when's that surgery? Your 8th. I think I'm on my 7th procedure. Could be 8th up. But I've not had as many laparoscopic surgeries. Laparoscopic. South Carolina. Hi, Angie. Sorry, I went off in a little daze then. Oh, that's the medication for you. This is me being really not alert. So the pre-op went well, but I do have high blood pressure. So I'm really panicking, thinking, what happens if on the day they didn't say anything to me about it. They didn't say, go see your GP. But what happens if on the day I've got high blood pressure? Are they going to stop my operation from happening? So I'm really worried about that. That's now probably going to give me higher blood pressure. I think my blood pressure was like 150 odd over 98. So I don't know what's that like? Is that really big, or is that, I don't know, I've not even looked. I daredn't. I do have a device that you can fix onto your own arm, so I'm going to test my own blood pressure later to see whether, it was just what they call, as my partner calls it, the white coat syndrome, where you go into an appointment and because you're stressed out about the appointment, you become, you have a higher heart rate, you've got high blood pressure, called the white coat syndrome. So I'm just putting it down to that, but I'm also worried because I'm thinking, well, is it because I'm overweight? Is it because my diet's bad? So maybe I should, these next few weeks, really work hard at getting myself tip-top shape, because I'm not actually feeling very good at the moment. I'm very tired, sore throat. I'm covered in, not covered, wrong word, but I have several sores on my body that aren't healing. And they flared up, but I daren't go to the doctor because I'm scared they're going to cancel my operation. So it's this fear of having it cancelled. I didn't realise it would bother me so much. One of the things I've also noticed is this is my last 4 weeks, between now and the 23rd of September, that I will have a period or have my hormones. So technically, this is my last opportunity to procreate. And it's actually bothered me. I've got, I've been blessed. I mean, it was a hard journey, but I have 2 children. My heart goes out to anybody who has difficulty with fertility. Honestly, my heart just aches for you, it really does. And this is my last opportunity, and it's felt, I don't know, I'm aware of it. It's like in my head, deep down, I have this thing where even though I don't want children, and it's just not been an option for me anyway, I just was there, boom, 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 boom. It's your last chance. I'm ovulating probably this week. It's my last ovulation ever. A real weird sensation, a really strange feeling. But I don't, obviously want to, so I don't know why it bothers me so much. So the pre-op went well, I'm sorry to see that, Diana. I do feel, it's just a horrible situation, the whole subject of conceiving and fertility and pregnancy and loss. I lost a child. It was born premature and he died after a day. It was a very difficult time. And then my other 2 children were born premature, and they were in hospital, and that was difficult too. So I understand, just what an awful situation it is, Diana. I really do. My heart goes out. Life is just unfair. It's just unfair. It's just no fun being an adult at all. The things you have to deal with, the things you have to learn to cope with. No wonder a lot of old people are miserable and moody because they've just had enough, haven't they? They've just everything. So it went well, did the pre-op. In that sense, I've got to have a blood test a week before. They do this new thing now in the UK. Apparently before an operation you have to have a blood test a week before just to make sure everything's okay. So that's like another hurdle. What happens if something comes back? What happens if I have an infection? And that's why my immune system's so low at the moment. So I'll have to just going to look after myself as much as possible. Yeah, I hate it too, Diana. I hate it for everybody else, and I hate it for me. It's just, somebody said to me recently that I was wasting my life being ill. They actually said, you're wasting your life being like this, Michelle. It's not me that's doing it. Endometriosis, it's not a disease that is life-threatening. And that downgrades it somewhat in people's psyche. But it might not be life-threatening as from a pathology sense, but it's life-changing, life-altering, and quality of life ending. The quality of my life has been impacted enormously because of it. And it impacts quality of life for loads of people. And not only that, it affects mood and mental health. And when your mood and mental health is affected severely, people lose the battle with their life in regards to mental health and suicide. Lots of endo sisters have passed away You see every couple of months young ladies who have either accidentally taken an opiate overdose, which happens, or has just given up. Well, not given up, that's not the right word. Has just had enough, and takes their own life. And that's what endometriosis can do. Doesn't do that to everybody, but I'm not afraid to admit, there have been times in my life recently, as in in regards to this illness, where I felt that low, that I've had to seek medical support to help me through that, because I felt like I didn't want to be here anymore. I'd had enough. I couldn't do it no more. But I got help, and that's the main thing. If you do feel like that, if you do feel really low, tell somebody else and talk about it. There is help out there, and you can do that. You can get help, and only you know your circumstance and your situation. So when you're feeling a little better, or if you're having an up mood, then you write yourself a note, a letter, telling you what to do when you feel that bad. And then you put it somewhere. And then when you feel that bad, and if you're feeling really low, you can read that letter you wrote yourself. Because only you know your circumstance, and you'll listen to yourself. So it's a good piece of advice I was given. And I think it's... Did I just squeeze my boob? I'm so sorry. I had no idea I just did that. Oh, I do apologise. Thank you very much, Diana. I'm trying not to stress about it. I'm trying not to think about it. But it's creeping up. And I have my own business, and I'm trying to get everything sorted. Because that's the thing, that you've got to be off work for 2 to 3 months, and I don't know how long everybody else was not off work. Have you got to be it now? How long have you got to be off work? I don't even know, because I've got my own business. I just try to ignore that information, because I just think, well, I've got to, I've got to go back to work when it's needed, because I don't have the financial means. But I will be taking a few weeks off. Thank you. Is it nah? I'm trying to take care of myself, and you take care of yourself too. Thank you. I'm just, I don't know about taking time off. How long did anybody else take off? I'm sure my consultant told me that the actual procedure, the laparoscopy procedure, could turn into a laparotomy. It could be bigger incision, but the plan is to go through the keyholes like they normally do for a laparoscopy. And I was told that expect to, really ideally you go home the same day. But when I had my pre-op, I was told it would be between 2 days and 5 days. So now I'm really confused, because I'm like, how long am I going to be in for? I suppose I didn't really know that anyway, because if something goes wrong, I knew that I'd be in. But I just thought, well, if it goes well, I'll be home the same day. So that's the plan, right? And now it's changed. So I don't know. These questions, I just don't know the answer to. But what I did do is I asked the group, what happened in your experience, and the feedback that, it was fantastic that there was so many replies and comments that really helped with that, not knowing, because some people did go home the same day. And some people have had to stay in a week. So it kind of made me think, plan for both. And I'm just going to plan for both. I've got a massive... Look at this book. This is a book for a book. Ready for this? Ready for this book? That's a book. I've got a Stephen King book to read. I've actually got another one like this. So I could read it in a day. I could read it in a week. So Stephen King's coming with me for my hysterectomy. Me and Stephen King, we are going to whoop this hysterectomy. I'm feeling positive, because obviously the positives outweigh the negatives. And I badly need this. So if anything happens to cancel it or affect it, then I'm just going to cry. I'm just going to be so heartbroken. I just badly need this operation. You've no idea. Well, you do know, actually. They're the only people that really do, those that go through it. I was going to talk about bowels, bowels. Because we don't talk about. Does everybody else keep seeing that fly that keeps flying over between my face there? I was going to talk about bowels. This morning, I just had such a bad tummy. Just such a bad tummy. Loads of pain. Not afraid to say it. Diarrhea. I had diarrhea. On the toilet. Room in the morning. I was so exhausted afterwards. And I get a couple of types of bowel pain. Because often what consultants and doctors will do first, when you present with problems and you're getting tenderness sort of in the tummy area here, they might say, do you know, IBS. It affects your bowels, IBS. The reason why they do that is because it's easier for them to go IBS and maybe prescribe Buscopan, Mebivine, something antispasmodic. Peppermint is also very good. But they do it because it's easier, and that's their reasoning. That's the reason I've heard. I'm not saying it's right. That's what I've heard multiple times from doctors and consultants, that it's the least invasive diagnosis, so they try it first to see whether they improve things. And what they do is they send you away. And they think those people who struggle the most will come back. But what they don't think about are those people who go home and it doesn't work for them, and they feel crestfallen, and they feel dissatisfied, and they feel left alone misunderstood by medical support, doctors, nurses. They feel let down, and they don't come back. But that's great for the NHS. I'll talk about the NHS, what we've got in the UK, because they don't want you to come back. It costs money. So off you go, because there's a saying, those who shout the loudest get heard. And it's true. I think that sums it up. You shout the loudest, you'll get heard. So like I've, for example, been sent away, nothing more we can do. Blah, blah, blah. And I went home and cried, and I got myself depressed. I didn't get me depressed. I became depressed because it was the lack of hope. My hope had been taken away from me. And from their point of view, they were happy I'd gone. But actually, I was getting worse and worse and worse. But I'd taken myself out of the circle because I felt like I was not getting the support and I was being let down. And it won't just be me. And those ladies and patients who are feeling like that are just left to just hover. But luckily we have groups like this, or other groups if you don't like this one, but we won't talk about that, that you can go to and get support and get help and get encouragement and hope. Because as long as you get hope and as long as you get an encouragement, you've got a chance and an opportunity to progress. But you've got to steer that ship yourself. But you need wind in your sails to do so, and that's encouragement and hope. That's your wind in your sails that get you to where you need to be eventually. That's what I believe. So I went back into the medical circle and started getting help again, because I said, no, that's not good enough. There is something you can do. And that's got me on to, a couple of laparoscopies onwards. Why can't I say it? Laparoscopies onwards. I can always say it. So I was talking about IBS. So they'll diagnose that first. Incidentally, that brown thing on my finger, that's paint. I've been painting a little elf doorway. Not for real elves, obviously, because it's not poo, okay? It's not a birthmark and it's not chocolate, just to make it perfectly clear, in case you're wondering if you see it. What was I saying now? I'm just talking out my arse. So they'll assume that if you don't come back, it's worked. They don't assume that you sat there and feeling misunderstood. So you come back again and you say, look, this is not my bowel. This isn't helping it. Now, one of the tools that will help in this situation is if you have a diary, some sort of diary that, or I've got this book here. It's a bit of a view of my boobies. This one, I don't know if you can see it. It says Endometriosis Pain Management Journal. I'll put a thingy in there. There you go. There's the ISBN. But I'll put a picture of it in the... and it's brilliant. I've not filled it in because I like to use it as an example. There's loads of bits for writing notes so you can understand your situation. And this has a balance between writing things about your symptoms and writing positive things. So it actually helps enforce well-being. It isn't just a document of negative things. There's positive things you can work on in there too. Brilliant book, brilliant. If you take a diary in and say, look, this is proof my symptoms are linked to my cycle or my hormones, or there's a pattern, they will take it more seriously. It's just a tool you can use. You shouldn't have to. They should just listen to your voice. Because, we know what we're talking about. It's our bodies. But they don't. So having proof really helps. Because what you're looking for is a referral. Now, what they don't link is the gastro people with the endometriosis specialists do, but general referrals to an NHS or a general hospital, you get referred to a gynae surgeon, or a gastro. So they'll have a look at your butt, or they'll look up your foo. Blech. Win-win situation, if you like bums or foos. You want a referral to gynae, and that's what I suppose you should say. I need a referral to a gynae. It's a gynecological issue that I'm having. But it's a very difficult situation if you feel like you have to battle. But don't stop battling. Take someone in with you. Make sure you write down your questions, write down comments that they say. Try and take in evidence. I mean, I don't mean, bag up your poo and take your poo in. But, try and, I suppose, advocate for yourself. And if you struggle to advocate for yourself, is my heating on? It is. My heating's come on. It's cold. Heating has come on its own. If you can't advocate for yourself, then bring someone with you who can advocate on your behalf, would be my advice. Now, my bowels do two things. I'll make it very brief to explain, so I'm not warbling on. I get pain. It sort of builds up towards my period start date. I get lots of symptoms that on the build up to when it, the waterfall goes when it all starts. But one of the things I get is diarrhea. Really painful, sensitive tenderness down here. And I feel like I've got, like IBS pain, like real tenderness, soreness. And I have diarrhea. I have hot, burning, poos, just, toilet several times, in a row, like I've got a tummy bug kind of poops. I get that at the beginning of every period, and that'll ease off as the period eases off. I get, it's not nice when you're heavy bleeding and heavy pooping and And then I also get stabbing pains. So, and these are any time in the cycle. And the belief that I have is, well, firstly, my ovary that's now gone was attached to my bowel. So, as you can imagine, they're stuck together. So when I stretched and moved and bent to pick things up, or it's like a piece of ribbon. It's not elastic. So when I bent and stretched, it actually pulled these apart, and the ripping of the adhesion and the pulling on the bowel. Oh, I've got tummy ache now. I think I need to poo. How bad's that? The irony. Just wait a sec. It's passing. So the adhesions will cause a stabbing pain. And I get these sporadic sort of stabbing pains. So when my bowels are moving and I've got my poop coming down my bowel, if it's that's a big poo. If it's a big poo, it pulls on the bowel wall, and then if I've got an adhesion attached on the outside of the bowel wall, it pulls that adhesion and it rips. It's like a ripping feeling. I do feel like someone's literally got a knife and they're going on my insides like that. Really painful. I mean, to the point where when I was measuring my pain over a month, by far it's the most painful thing I experience because of my condition. By far. And it exhausts me. If I have an attack of this, let's call it an attack, it's exhausting afterwards. And it's like that if I'm then pooping, I have this awful poop and feel the pain that just goes on, and it's just exhausting, and that's my day ruined. Not like as in I'm in a bad mood. I mean, my day physically, I'm exhausted from it because of the pressure it puts on your body. So a lot of people don't talk about bowels, so it's not something you might talk about with your friends. Or people might say, oh, well, yeah, I get that too, or I get tummy pain. This kind of ripping of adhesion pain is just so painful. I had a sigmoidoscopy where they have a look at your bum because of these bowel pains and the problems I had, a bit of bleeding as well. So they want to have a look. So they filled my bowel full of air to expand it so they could have a look. And it just, because of the expanding, it was just ripping. It was the most horrific experience of my life. No sedation, no pain relief, just pure torture. And I remember laying there, and he was a grumpy man with about as much personality as my butthole. And it just, barely spoke to me anyway, because he was way better than me. Even though he's looking at my bum. Who's got the better job, really? I don't know. So he's looking at my butt, and I was screeching in pain. And he was tutting. Well, I'm done now. And I literally leapt off the table. I walked straight out the surgery room. I got dressed, and they tried to give me the toast and tea that they thought that might make it better. Because toast and tea is really going to make that better. And I just walked out, got in my car at the hospital, and I cried. It was traumatic. And a lot of these procedures that we undertake are traumatic. And the trauma that I felt after that, I got home, got into bed, I just cried and cried. It was horrific. I was in so much pain. I've had one since, and I was sedated. I explained this to them, and they were much more sensitive to the cause. I'd also had surgery after that to remove these adhesions, and that's when I learnt my ovary was attached to my bowel, and that's why I was in agony. And these experiences won't just be my experiences. These will be experiences that many of us have shared. And that's why talking really helps, because you realise you're not on your own, and you realise that maybe if you're not comfortable talking about bowels and bums, it's all right, because I am. I don't mind at all. Not everyone's seen it, but it feels like everyone's seen it. Talking of which, it's not official yet, because the surgeons involved with the hysterectomy have not, they've been away, so we've not got they've not spoken with them. But I think the BBC are going to be filming my hysterectomy, and it's going to be on the news, like 6 o'clock news, 10 o'clock news. I'm only hoping they keep it above waist, because I don't really want anyone... I don't actually want everyone seeing my bits. That was, But, so it might be filmed for the BBC as an awareness piece. So fingers crossed, because that'd be, I don't know, that'd be like, ha to endo. Bye. Getting you filmed and put on BBC, ha. But we'll see. The hospital's approved. They're really happy about it. I'm okay about it. Let's come back again. I'm happy about it, but the surgeons haven't got back yet, so I'm not sure. But once that's confirmed, I'll share a bit more information about that. But that would be cool. I think that'd be cool. I quite like the idea of documenting and sharing my experience to help others, because that's what it's really all about. This isn't, I don't do this for likes. I don't do this so people can just be like, oh, you're amazing. It's not, none of it's about that. Ever has been, it never will be. It's about sharing information, legitimate information, to be productive as possible for everybody, to help. We're all in it together. We're all in it to help each other. You guys help me I've asked about, for example, the hysterectomy, and you've helped with that. How long you're in hospital and things. And, if I can give back, it's like a finger up to Endo. It's like going, I'm winning, and I'm only human. This isn't my job. This is just me having a place to go and for other people to go. That's meant to be a safe place. And we'll leave it just at that. Hi, Lucero. That's a very nice name. Lucero Torres Bravo. Love that name. It's like a vampire hunter. Lucero Torres Bravo. It's terrible as endometriosis. I know. It can make you feel like that. You just, every month you feel like you've just got a demon on your back, So I'll post again nearer the time. I've got 22 days to go. Got a really good piece of advice someone put on a post this morning about bowels and surgery. And before you have a surgery like a laparoscopy, because when you have the surgery, you will be on medication, like pain medication, which can bung you up. And also, you can, because of lack of activity, have risk of constipation. So sometimes it's a good idea to have laxatives, mild laxatives, to get your bowels kind of emptied, like a prep before surgery, so you're cleared out. And I thought that was a really good piece of advice. I actually have a bit of a tear. What that meant? Ooh, in my bottom. So it's always important that I don't get constipated, because that rips and it's really painful, and it bleeds. And apparently it will never go away because it's like so big, and the cells around it are weaker, so I'm more prone to tearing. So I've got to be very, very careful. Also, another piece of advice, you're either going to think I'm mad or you're going to think I'm a genius, and I'm not the only one who does it either. If you're really constipated and you do struggle with constipation and you can't seem to get your poop out, there's a little trick. Don't ask how I found out. Don't ask questions. Just listen, and if you're ever stuck in this situation, you might thank me. You might really thank me. I wish someone had told me sooner, because I've spent many, many an hour in tears because I couldn't get my poo to get out, right? What you do is you get your thumb. You know what I'm going to say? You don't put it in your bum. Don't put your thumb in your bum when you're doing that. Put it in your poo. So I'm going to go that direction, right? So you nail upwards, put it in, and you'll feel the vagina wall between the bowel wall, and you gently push down. So you're kind of pushing at your poo from through your vagina wall. It's like pushing through a curtain, to the window, right? And you can actually give it a bit of momentum from behind, and you can push your poo out. And I never knew that. And it's like, what? But seriously, in times of need, it's an absolute godsend, because I don't think I've ever been struck now with that awful, can't get it out, and I need to go out, and it's stuck, and I feel awful. And it's a good piece of advice, and it'll help a couple of you. And it's not just me that does it. I haven't just picked up this trick, and other people do it too. So I'm not a total weirdo. So I've passed that on. That might help somebody. I'll leave it there. I'm getting really tired. I might have a little nap. I'm not sure. Any questions, any problems, as always, just private message me. If anybody was offended yesterday by me sharing that post, I can only obviously apologise for the distress that caused. Now, I do stand by the fact that by having it on there, that information, we've had a real discussion about it, and I think it's worth the value keeping it on, because people who come to this page will see that, they can have a look at it, and they will use your comments to educate and guide them to avoid any pitfalls, if that's the case. So I do think it really does have value. I didn't kill your cat. I didn't, butcher 100 whales in the Faroe Islands. I shared a bit of information, and I did say very clearly, it's not something I endorse. And I did say that it may help, and that still isn't incorrect, in the sense that sometimes some things help. That's all. Hi, Patsy. So if it helps one person, there was no pushing, there was no saying, hey, this is a cure. Never come out of my mouth. Not once. Not at all. I'm just all about sharing information. Hi, Patsy. And letting people decide for themselves, because we are all adults. I've been doing this page 13 years. I've raised thousands and thousands of pounds. I've helped hundreds and hundreds of women, and women have helped me. I've been in media, I've written blogs. I've put a lot of my personal time into this because I care, really, truly, passionately care. And I think until you've done the same yourself, you cannot turn around at me and start having a go, because you can't. You got a problem, you get into my DM me, and you respectfully, like an adult, explain why you're concerned, and then I can react accordingly, because that is what adults do, and that is where I'm going to leave it. Okay? So thank you very much. Thank you for listening. Like I say, I apologise for any offence caused, and if anybody knows me, then no one was ever meant. Wish you all the best, everybody, and I'll be in touch soon. All right. Bye, guys. Bye.